Good afternoon. Welcome to day 333 at the EMA office where we're still bringing you these numbers, and we've got a lot to talk about with the vaccine, and we're joined with Chairman Mark Kern and today the operations manager Randy Randolph. You get to be the health department representative today.
That's big shoes to fill, but I'll do my best for sure. So today, day 333, here's the numbers for St. Clair County. We've tested 266,853. That's an increase of 969 since yesterday. Positive test results are 26,861. That's 71 new since yesterday, both males and females under the age of 10 through their 90s. And our daily county positivity rate is 7.3%. Negative test results is 239,992. We're happy to report that we don't have any additional deaths. Our total still remains at 425, which is still a really high number, but we're glad we're not reporting any additional deaths today. Those that have completed their IDPH required 10-day isolation period is 25,522. For the state, they've tested 16,739,500 with the positive test results of 1,150,170, which is an increase of 2,082 positive test results since yesterday. For deaths, the state is reporting 19,686, which is an increase of 20 since yesterday. And as always, our thoughts and prayers go out to the family and friends of those who have lost the battle with COVID-19. For our hospitalization numbers, those currently hospitalized in St. Clair County, there's 82 COVID-19 related patients, and 6 of those are on ventilators. Regionally, we have 132 patients hospitalized due to COVID-related reasons, and 7 of those are on ventilators. For our congregate living facilities that are in outbreak status, and this is cumulative since the beginning of reporting, we will announce the changes in facilities. For St. Paul's Home, there's an addition of 6 cases, bringing the total to 169 cases and 28 deaths. And Sycamore Village of Swansea has 38 cases and 1 death, which is an increase of 1 case. Just as a reminder, on Friday, February 12th, from 8 to 4 at the Caseyville Village Hall, there will be COVID testing occurring there, so we encourage everyone to take advantage of that, as well as the testing that's ongoing at the St. Clair County Square. St. Clair Square. I'm getting fairgrounds and square mixed up, but St. Clair Square is where that testing is occurring. So I'll turn it over to you, Chairman.
Great, thank you. Appreciate you keeping track of all the numbers.
Thank you.
Thank you. Okay, let's look at the zip code report for today. In 62203, we're up 2 to 582. 62204, we're up 1 to 365. 62206, up 3 to 1,227. 62207, up 1 to 553. 62208, up 5 to 1,500. 62220, up 10 to 1913. 62221, up 5 to 2579. 62223, up 2 to 1,600. 62226, up 9 to 2,961. 62232 is up 2 to 837. 62239 is up 1 to 429. 62243, up 3 to 699. 62254, up 3 to 756. 62257, up 1 to 323. 62260, up 2 to 743. 62264, up 1 to 338. 62269, up 7 to 3,040. And 62285, up 4 to 528. As Randy said, 71 new positives today. 969 tested, so the testing's down a little bit. We need to make sure that everybody that needs a test is getting a test, so remember those testing sites and get out there. But that brings our county positivity today to 7.3%, which then brings the rolling average today up to 7.2%. Regional positivity is also up today to 5.7%. Bond County called in at 2.4, Clinton County at 3.7, Madison 8.6, Monroe's at 19% today, Randolph at 17.3%, St. Clair 3.1%, and Washington 0% today. So good job to Washington. Coming in at 0 is a good thing. Herb, I'm getting nothing but positives about the fairgrounds. I know there was more of a quantity of people that went through earlier in the hours today because of the temperatures, and it seems that everything worked smoothly, and that the public is being very patient. They understand that there are issues that happen when you're working outdoors, and you have as many people as we have there that are working through many agencies, including the Guard and the Health Department and hospitals and all the volunteers we have. So we appreciate the public, and it's working. We're reaching our goal of 1,000. And also, as we spoke about yesterday, we were concerned about vaccine, but it appears that the state will be delivering more vaccine, and so we will not see any hiccup in operations, certainly in the timeliness of operations. We think we'll be able to continue on our schedule.
Well, that's, as we've said now for past several days, we can't schedule appointments without having the product in hand. And so we've been told it's coming. They're not here yet, so that's why we can't schedule those appointments. But once it gets in the inventory, the health department will start releasing some more appointments. Another good day down there. Cold, but we're taking all the precautions that we can. I had 2 more large commercial furnaces brought in today to help keep the staff, the National Guards and the medical staff that's providing the service. And you're right, the people who've been coming through there, and the comments that Team St. Clair have been leaving, it's just been overwhelming. And I pass those messages along to the staff down there, and it gives them a sense of feeling good too, that knowing that people are appreciative to what they're here doing, trying to help us, because some of the medical staff are from other states that are here working, and it's really good.
And the operation, so, very matter-of-factly, we talk about heaters, but those were brought in from your St. Clair County Emergency Management Pool. George brought them there, and then had to get the generators, which also are part of the St. Clair County equipment pool that we have.
Tools in our toolbox.
They are, and they run, and those. That's why. There are people who keep these items maintained in an operating order, so when we need them, like we needed them today, that they're available, and we're putting them to good use. This is a great lesson in why you need to have things on hand in case of an emergency, because these type of things, although let's hope this never happens again, emergencies do happen, and having that equipment on hand certainly allows us to continue with smooth operations, so the public really doesn't see a difference between getting their vaccine on a day when it's 0 degrees outside versus a day when it's 60 degrees outside.
Well, and you talk about, that's what emergency management is all about, to being prepared. We like to think that we never have to use that equipment. It's there. You keep it maintenanced and keep it all clean and shiny and everything. But it takes the guys that, like George and his staff, to go out to the sheds and the garages and make sure they're running and they're fueled, because you never know when you're going to need them. Whoever thought that we'd be doing a disaster for 333 days through a pandemic? But now we're needing that equipment, and it's nice to know that you can call and get it there and help everybody out. The FEMA team that we talked about a couple of days ago will be in town tomorrow. We got 8 members of that team coming in. We're going to beef up the call center because we got to get those people in there a break, because they got the phones glued to their ears, and we apologize if you've been calling and have to keep calling, but we put in some more lines, and that personnel will actually be in town tomorrow. In fact, Randy is going to be running them through the training real quickly, and so we're going to boost that up, 4 to 6 more people, I think, on the phone line. So, and
with the assurances of a large quantity of vaccine available, we'll be able to start pushing those appointments out, and that will get us through this 65 and older category, and then we can move into the next categories that we're looking at. And one of those categories then, after we finish the 65 and older group, is teachers, and they will be up next after the 65 and older category is taken care of.
Right. And don't forget, if you haven't signed up on the portal for the showing your interest in it, as of today, 72,440 citizens have done that. That's a increase of 1,392 since yesterday. So please, Team St. Clair, keep sharing that word to your friends and families. That's the place to start. Call and get that portal or go in and sign up on it. It's real easy to do on the EMA page or on the health department's page or on the county's page. That's the first step to do. Go in, fill that out, showing your interest, and then that starts the process of getting you your vaccine that we want to do. So please, as we said, every day now, patience, especially if you're down there in line. The medical staff is doing the best they can. You know, I was down there with 16 degrees out there this afternoon, and they didn't miss a beat. They were putting the needles in the arms, and but just be patient. It may take a little longer, but we'll get you done and get you out of there. I know you said that you had a couple calls this morning and people were happy, and that's what we want to do. So we'll be back with Cindy in a few moments to translate this today's information into our Spanish communities, and we'll be back tomorrow for day 334. Everybody have a good evening.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.